Today I'm going to share with you about cancer prevention. I think every one of us, we want to know what is cancer prevention, and no one wants to have cancer in this room, I believe. Yeah, I belong to West Medical Group. West Medical Group is a part of the West Clinic USA, and we provide all different kinds of cancer treatments, and we believe in the best cancer treatment for all the cancer patients. And I want to say that we are the first oncology group that having palliative care physician on board, and we provide not only the oncology treatment, we also help the patients to relieve pain and other symptoms control. That's the reason that I'm the part of the West Clinic Medical, and I just joined them last month. Okay, today we will start off cancer. I think every one of us, we know cancer. There is no one in this room never heard of cancer. Cancer is not new. All of us in our body, we have cancer cells in our body. The only thing is these cells, when they develop and they grow out of control, then there is a cancer. And cancer is not a single disease. There are more than 200 different kinds of cancer, and the different cancer has different name and different treatment. Like something like blood cancer, we call it leukemia, and lymph cancers, we call it lymphoma, and different cancer has different treatment. And some of you may have heard of benign and malignant. What is the benign means? That means these tumors cannot spread, and only they are localized in the area and they are not life-threatening. Malignant means these are the tumors that are capable of spreading to the invade locally, or metastasis through the blood or lymphatic, and is life-threatening. That term malignant tumors is equivalent to cancer, which is life-threatening. And as you can see, that cancer is the leading cause of death in Singapore. In 2006, almost 1 out of 4 deaths is due to cancer, followed by the other diseases, heart disease, pneumonia. In other countries, cancer is not the first leading cause of death. In Singapore, we are the one facing leading cause of death. Here, these are the top 3 cancer affecting in Singapore men and women. Lung cancer is the most common cancer, followed by colorectal cancer and the stomach cancer. In women, breast cancer, I think all of us, we know, is the most common cancer, followed by the colorectal and the lung cancer. So if you have to combine both men and women, colorectal cancer is the most common cancer in Singapore. And I will elaborate some of the cancers which can be prevented and which can be detected early stage. Of course, breast cancer is the commonest cancer in the Singapore women, and you can see 1 in 5 cancer occurring in Singapore women, and it's a breast cancer. Every year, we are detecting 1,100 new cases in Singapore, and out of these 1,100 cases, 270 women die from the breast cancer every year. And each of us, every woman sitting in this room, 1 out of 20 women in their lifetime, they will get breast cancer. And the incidence is highest between at age of 55 to 59. How does breast cancer present to us? Most of the time, it's a breast lump, followed by sometimes it's a nipple discharge, which is a blood nipple discharge, not the ordinary milk discharge or yellowish discharge. It's a bloody nipple discharge. Or sometimes there may be only skin changes, no lump or no discharge. The skin can be like very thick skin, like orange peel skin kind of things. And sometimes can be the patients will have itchy nipple or rashes in the nipple. And lastly, the patient will complain of pain in their breast. Okay, what are the signs and symptoms? Most of the time, 80% of the women, they are the one present themselves having lump in the breast. And these lumps may or may not be painful. And the best thing is 80% of the breast lumps are not cancerous. Sometimes they don't have the lump in the breast. They may have a lymph gland enlargement in the armpit or axillary region. Sometimes some patients, they don't even know they have breast cancer, and until the cancer has spread to the other part of the body, like bone, liver, brain, and then they came and see us. Okay, how can we fight the breast cancer? There are 3 things we can do about it: prevention, and early detection, and better treatment. Of course, prevention, not all the causes we can prevent, but we can adopt some of the healthy lifestyle, which I will elaborate further later. And we can go for early detection. Early detection is still the best before we get anything to get the cancer. Of course, if you already get the cancer, the best thing is you get the best treatment, like come and see the doctors in the West Medical Group. We get the latest treatment, the best drug, and this can save the life. So I want to emphasize you again, aim of breast screening is to detect the breast cancer early, so that with the effective treatment, the ladies can live longer. So what are the guidelines for breast screening. If you are 40 years and below, just do your breast self-examination every month and you go and see the doctors every year. If you are between 40 to 49 years old, you must remember to do mammogram yearly. In Singapore, we recommend yearly mammogram because the incidence of breast cancer in Singapore women, the peak is like 45 to 50 years old. And if you are 50 and above, you can go for mammogram every 2 years once, which is enough. Then I will move on to colon cancer, which I have mentioned it to you before. Second commonest cancer in both men and women, but if you have to combine, it's the commonest cancer. And the incidence of colorectal cancer is also increasing recently, and that starts to increase at the age of 50 onwards. What does colorectal cancer mean to you? I have mentioned it to you, about 1 in 20 Singaporean people in this room, their chances of having colorectal cancer is 1 in 20. And these cases also like increasing incidence, and sad thing is almost half of the people, they die from colorectal cancer. The reason being is they don't go for screening, and at the time they are diagnosed to have cancer, the cancer is already advanced stage. This is the commonest size of colorectal cancers that you can see, like 30% of them is in the rectum and then 20% is the descending colon. Okay, how should we do guidelines for the colorectal cancer screening? Who should go for screening? Everyone, all of us, everyone in this room, once you reach at the age of 50, we must go for the colorectal cancer screening. Of course, those who have the family history, like first degree relative, like your father, mother, uncle, auntie, then you should start the screening even 10 years younger at the age of 40. Those who have the family history, more than 2 first degree relative in your family, you should start close monitoring and go for a regular screening. Then I move to another cancer, which is cervical cancer. Cervical cancer is, I must say, that it's a very common, but it's also very, it's a preventable, and go for early screening and can be prevented not to have the cervical cancer. In the worldwide, every 1 minute we are detecting 1 cervical cancer. Every 2 minutes, 1 lady will die from cervical cancer. In Asian region, in our region, every 2 minutes we are detecting 1 cervical new cases, and every 4 minutes 1 lady died from the cervical cancer. So before I finish my talk, you can imagine how many ladies will be dying from cervical cancer.